because I did see maybe about a quarter of you were at the May 8th meeting, but a lot of you were not. So I want to let you know how we got here. In September 2018, there was a board motion, and the board motion was about the concerns that everybody was hearing about all of the board and cares closing. And actually, I think the board motion only talked about adult residential facilities. But then when we started talking to all of you and talking to our partners at CCL and talking to our partners who we've been working with for a few years already, we heard that, hey, this is also really impacting the RCFEs. So any clients that you have, over 59, it's a different licensure, but it's the same impact. They're closing, they're impacting our population. Housing for Health happens to focus on the homeless population, and it's a very big prevention issue. And also, it has to be a resource in our continuum, and that's what we've sort of been learning over the past few years. And the board has woken up to that. And so, as I mentioned, September 11, 2018, they did a motion, which was, the long and short of it was, do some research, DHS, DMH, and your other county partners, and help shore up these facilities that are closing. Really concerned about the impact on beds that were for people with serious mental illness, which is sort of why DMH was in the lead. But DHS was also working with a lot of folks with severe mental illness and health conditions. And we all realized we needed to work together to stem the tide of the closures and to figure out what needed to happen. We were tasked with reporting back with specific strategies. And May 8th was when we had all of you guys, and we did a lot of work that day. I think it was a full day. Was it a full day? It was almost a full day. We got a lot of great feedback, all of which went into a report that went to the board in November of this year. And we had a consulting firm, for those of you who were there May 8th, we had consultants who helped put that together and did a lot of interviewing of all of you and groups around what we could do to shore up this community. There had been 3 additional motions by the Board of Supervisors since that September 11th, which just goes to show that there's a lot of attention and a lot of willingness to think about the resources needed to bring to the table. One of those was in November 12th, 2019, which had the stakeholder report was submitted to the board, and as a result of that, the board said, let's move forward with these recommendations. So both Department of Mental Health and Department of Health Services are operating an enriched residential care program, which essentially was born because we realized that board and cares, ARFs and RCFEs, were not accepting our very challenging clients at a rate of $35 a day, which makes perfect sense because you can't operate on $35 a day, especially with extremely challenging clientele with multiple complex issues. So we found out what it would take for you to say yes to our clients, and what that was helping with an enhanced reimbursement rate so that you could actually provide the services needed. DHS currently funds about 1,200 slots of enriched residential care in many of your facilities. We stopped taking new clients as of July 1st in 2019 because we ran out of funding. However, we were recently approved for 300 additional slots for our complex clientele who are in our Department of Health Services hospitals, who no longer need acute care but need a board and care, but are complex and complicated. And so the department has agreed to fund an additional 300 slots, which we hopefully will be starting to use those slots and on March 1st, that's our goal. DMH is currently funding around 775 clients, and that's between their enriched residential care and their whole person care programs. Since the beginning of fiscal year, in July 2019, DMH received about 125 new referrals. 72 participants were effectively and successfully moved into an ARFA and RCFE. 53 are currently pending move-in. And DMH will continue to accept referrals for new ERC placements for people who have serious mental illness. Between these two programs, we're providing funding in around 180 facilities across the county. So based on, this is mine, right? This is my slide? Okay. Based on the feedback that we collected during that stakeholder process, that year that we spent talking to you guys, doing groups and listening, we have the stakeholder report provided recommendations in these areas. One is creating a capital improvement program. Why? Because we heard that you guys had a lot of deferred maintenance, that your facilities needed TLC, and that in order to have a productive, lovely environment, that you need help with some capital tenant improvements. Two was to seed a membership association for ARFs and RCFE operators serving SSI recipients. Something like this, where you have a chance to talk about things that are of mutual interest to your agencies, to advocate. The power of advocacy at the state level is incredible. I mean, you have to harness that and have to make that something that is powerful. And in order to do that, you have to band together. You can't do that alone. So we heard that. We think that's very, very important, that has been extremely powerful in other sectors. So that was one of the recommendations. 3 is to implement a public-facing bed tracking system. What that means is that you could put your available beds on a website and somebody could see that there's an available bed and call you and find out if there's a match. And that's really very important. You would have to actually enter your beds in that system, your vacant beds, but it probably is well worth your time to do that and have your beds vacant for less time. Also to pilot on-site substance abuse services for large ARFs and RCFEs. That means partnering with our community colleagues at the Substance Abuse Prevention and Control, who have contractors that provide substance use treatment. And we have a couple of agencies that were piloting this approach to have field-based services in the larger ARFs and RCFEs. So you should look for that in the future, that will be something that will hopefully be available to your sites. Creating training and free continuing education opportunities for operators. Training, obviously incredibly important, something that takes time, it takes energy, and you don't want your people away from their work. So hopefully having some of that put onto another entity to have those opportunities for you are very important, and we heard that. Continuing to identify and participate in opportunities to take legislative action. Obviously, our membership association will have very, very big impact on that. But the advocacy at the state level has worked, and the governor has heard the advocacy, and the governor has taken action in his budget. So all of that is really important to keep pushing and to keep our foot on the pedal, if you will. I'm going to turn it over now to Maria, who's going to go in a little more depth of what I was sharing with you.
Libby, before you leave, I was thinking that we have staff that are on the phone with a lot of you, and you may not know who they are. And actually, I had an opportunity for some of you to come up and say, hey, we spoke on the phone, I just wanted to introduce myself. So I thought it'd be nice if we could just quickly introduce our staff who is on the phone with you or emailing you. So at DMH, we have Christina Ho, who's in the back, Christina, and then Jackie Drown, who's right here. So you should know them if you're an operator and working with us. They're the ones that you're sending your list to, or they're approving the people moving into your facilities. So that's who they are. And then, do you want to introduce your sure?
So Ronnie Thomas, start with Ronnie. Yep. Lydia's here. Patricia, everyone should know Patricia, who works with my unit. Beatrice, Lisa, Sonia does our quality improvement, Sarkis, and Esther. Did I forget anybody? Is anybody else here from my staff? Great.
Great, thank you. Also from DMH, I also want to introduce Dr. Amanda Ruiz is here. Where is she? Oh, there she is. So some of you received funding through our whole person care program. So she oversees the unit that provides that funding. And then Connie Drexler, our public guardian, is here. So you all probably know her because of the clients on conservatorship that may be living in your facilities. So just want to thank you all again for being here and wanted to make sure we can make these connections. So I'm going to continue this presentation. Libby really kind of set the stage that we went through a whole stakeholder process. We got the input from many of you, if not all of you, through that process. And through that process, all the recommendations that she just went over went to the board. So we submitted the report to the board. If you didn't get it, let us know. We can send that out to you all again. I'm going to go into a little more detail on where we're at. As Libby said, there was a fourth board motion on November 12th asking for a 30-day feedback. And in that board motion, the board said, okay, you have these things that you've identified that are critical that need to happen. What is the next step? Where's the funding to focus on these? So we did a 30-day report back to the board, and the first thing that we said is that we have identified $11.7 million from DMH's budget. It's Mental Health Services Act funding. And this is what we told the board that we would do. So most of that 11.7 million, around 11.2 million, we are going to use for the creation of a capital improvements program. So you all, as Libby said, many of you said you have a lot of deferred maintenance. And we know that our clients that are living in your facilities will have a much more positive experience if you're able to take care of some of these, some of the deferred maintenance that you've had to, that has gone on for a couple of years now. So we do plan on using that money to creating a program. It will be used, the things we heard from you that you needed the money for were things like for roof repairs, for bathroom repairs, installing accessible features, interior paint, air conditioning and repair. So those are the types of things that will be allowable uses of that funding. So where we're at right now is we're working together, we're working with our county councils and analyzing what is the most efficient mechanism that we can use to put this money out that would allow you to apply for this funding so you can start making some of these repairs. We've also met with different philanthropic groups to see about their interest to partner with us in potentially also funding deferred maintenance. So we actually have had a couple of meetings, some positive response, and interest from different philanthropic groups that want to partner with us in this effort. And I have to say that, you know, before the past year or so, no one was really talking about this. Even in philanthropy and the homeless services system, we were not talking about boarding cares. And I want to say that everyone is now. And I just want it, that really reflects the changes that have been made over the past year and a half or so, that people are talking about this, they see this as an important housing resource, and I think that's why we're getting a lot of, I think, momentum in making change. So we anticipate the release of this solicitation in the spring, and so more details as we know them, we'll let you all know them. We have a whole group email that we send out information to, and so we will continue to provide that information and make sure that you're aware when we're ready to release this solicitation. So the other thing, as Libby already mentioned, is the membership association. That was part of the feedback that we got. So of the $11.7 million, we said we'd allocate about $500,000 to help seed a membership association. And I think the value of the association is that it provides an opportunity for you all to meet together, to share best practices, to have the membership association can sponsor training and educational opportunities for you all, and then also for you all to share strategies and to advocate either locally and at the state level, so you can so people can hear your voices and the needs that you all have. So that's what, so with the membership association, we are, like I said with the other one, we're still exploring really what is the best mechanism to determine who would be the lead agency that would do the membership association for us and then engage with all of you. So we're still exploring that and determining the best way to go. Oh, okay, yeah, there are seats up here. If you could raise your hand if you have seats next to you. There are several seats in the front here. There's a couple over there. There's one back there. We don't want people to have to stand. Thank you. So the other thing that Libby also talked about was the bed tracking system. And so we've been exploring different programs where we could have a bed tracking system. And Department of Mental Health actually is in the process of developing a bed tracking system. And we did have a demonstration of it, and it does seem like a system that we could use that would be, again, free to all of you to be able to use. The idea is that it would be public facing, that if you're an operator, you have beds available that you could, in a very simple way, we hope, that's our goal, is to make this simple, maybe from your phone through an app. Just upload if you have vacancies. You would initially be able to upload, like, who is your target, who do you serve, like any specifics about the demographics and the types of beds that you have, and then you can upload when you have vacancies, and then as people are working with their clients looking for an available bed somewhere, that they could go to that same system and see that there is a vacancy, and then they could contact you. And we do think that will be an efficient way for you all to fill your beds faster. And right now a lot of people are just on the phone calling everybody. Do you have a vacancy? Do you have one? And that's not the most efficient way. So this is our goal with the bed tracking system. We're going to be part of, like I said, DMH is already creating a bed tracking system, and we've been told that in the second quarter, which will start April 1st, that they hope to start rolling this out, and we're one of the initial groups that they're going to roll out and test this with. So that is what we hope will be happening very soon with this bed tracking system. Training and education, we're happy to say that we are trying to partner to create training opportunities for you all and for community care licensing. So DMH, we had staff, I think there's staff that work for Connie Draxler that have been trained in mental health first aid, and we provided that training to the community care licensing staff as a first kind of rollout in our partnership and working together to make sure that people understand what is mental illness and how do we help people that have mental illness. So we did that training. On March 4th, we are going to be offering a free continuing education training entitled Effective Contacts with Residents with Mental Illness. So that is free to you all. And we are going to have our staff that are trained in doing that at the department actually be able to provide that to you. It'll be designed for operators of facilities serving people on SSI and that have mental illness. And it'll be 2 hours of CEUs that you will receive, and we're going to have it in planning area 2. So that will be our first testing of how this goes, see what the response is and the interest. And so if if people find that helpful, we can look into expanding that and doing other trainings. Service planning area 2, in case you don't know, is the San Fernando Valley. So that's where that's going to be located. And then the last thing I'm going to talk about are legislative updates. So this has already been, I think, referenced, but we're very happy to say that the County Behavioral Directors Association, also known as CBHDA, and that association is all the directors of behavioral health departments in each county across the state, that they come together, they have an association, and they advocate together. And they sent a proposal to the governor asking for $500 million to be dedicated to ARFs and RCFEs. And it was a one-time money request, but what it said is that we're asking for this one-time solution while we work on a longer-term solution to focus on this issue. And we think the longer-term solution is to get the overall state rate increased, and that is what will help us. That would be awesome. But this short-term solution was what was initially sent to the governor. So the Board of Supervisors actually did a 5-signature letter asking the governor to support this proposal from CBHDA. I can say that also LAHSA, Los Angeles Homeless Services Authority, their commission also sent a letter to the governor asking them to support this proposal. So there's, again, it's not just you all, people that have been focused on board and care, is that we're now expanding to a wider community and a wider community of stakeholders that are really advocating for these issues. So you might be aware, if you're following the governor's budget, that his initial budget release included $750 million for housing that could be used for subsidies for housing, and it specifically included language that some of that subsidy money could be used for ARFs and RCFEs, that was an allowable use. So that was promising. I think it was in response to the $500 million request. But I can also say that there continues to be advocacy, advocating for that $500 million specifically for the ARFs and RCFEs, in addition to or separate from the $750 million. That dialogue and advocacy continues across the state. Something else that we talked about last year, because this bill was introduced last year, AB 1766, Assembly Member Bloom is the one that sponsored that. He's from Santa Monica. Dr. Sharon, he mentioned him earlier as being an advocate in this area. And a bill was created last year that asked for an increase in data collection standards. And really, this seems simple maybe, and we're asking that the counties be able to get more information about what facilities are out there, who they serve, do they serve people who are on SSI, that receive SSI, and what is the demographic of that population. And we think that data will really help us in the work that we're doing and the advocacy we're doing, and to better understand the network and what's happening with the network. So that bill continues to be alive. And we're working with the Assembly Member Bloom's office and Steinberg's office to work on the language of that Assembly bill. Let's see, and then I think the big thing on here, and we've already mentioned, is our longer term goal is to increase the over SSI rate. And 1,069 is not enough money, to really be able to provide the services that we need to people that are very vulnerable, that have very high needs. And so we are all advocating toward that end through all these different efforts. So I'm going to end there, and I think I'm turning this over to Lisa Conmore, who is one of our consultants that is still working with us on these issues. I know many of you know her from she wears different hats in the community, but one of those hats is being consultant with DMH and DHS, and she's going to kind of moderate the rest of our day here. So come on up, Lisa.